Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be going over Hydrofera Blue Ready. But first, if you could hit that like and subscribe button, it would be truly appreciated as it does help my channel grow. So let's get started. So Hydrofera Blue Ready is an absorbent polyurethane foam with a waterproof cover layer. It is methylene blue and gentian violet, which provides a broad spectrum antimicrobial effect. It does not require hydration prior to use. So that's the difference between the classic and the ready. The ready does not require hydration prior to use. And the Hydrofera Blue Ready, it does not put any of the actual antimicrobial into the wound itself. It contains all of it inside of it, and as it collects any exudate or exudate goes through it, that's when the bacteria is killed. Use this product for wounds that have moderate to large amounts of exudate that are showing signs and symptoms of a local infection or suspected biofilm. Okay, so if we aren't having signs and symptoms of a local infection, we really don't want to use an antimicrobial on the wound unless they're at high risk of obtaining an infection. So we can use it prophylactically for infection. And we can also use this under compression or total contact casting. Just make sure that you cut little slits in it to make sure that the exudate can pass through easily. We can also use this with enzymatic debridement or growth factors. Some precautions that you want to just be careful and kind of reminded about is that if we're using this past 6 months, we need a clinical review from a wound care specialist or nurse practitioner. The dressing has not been tested on pregnant or breastfeeding women, so that's just a precautionary. And contraindications, we're not going to use this for patients who have a sensitivity to any of the ingredients, and we are not going to use this on a 3rd degree burn. Same with the classic, we're not using it on any 3rd degree burns, this product. To apply this dressing, we're going to make sure that the wound is cleansed with some normal saline, clean the wound and the peri-wound, getting any debris away from the wound, and then we're going to dry the peri-wound. We're going to select an appropriate size to cover the wound and that some is overlapping onto the wound skin. When using under compression, we want to make sure that we have the little slits, so you can just take a scalpel and just make a few little slits so that any exudate can easily pass through. And then we're just going to secure it with tape or cling. So to remove this dressing, we're just going to simply take some forceps and peel it back. If it is sticking, just make sure that you use some sterile water or saline, and it will lift up. So you're going to monitor the dressing daily for the first little while because there is an indicator. So it turns from blue when you start and it goes to white. So when it needs to be changed, it turns white. So you're just going to monitor it daily, checking to make sure that it is still that blue color. Say on day 3, it changes from the blue to the white. That's when we want to change this dressing. Now, it can stay on for up to 7 days, but it just depends on the amount of exudate passing through into the dressing. That's when it turns white. When the actual properties of the dressing are being used up, it turns white. So the expected outcome of this dressing is that we don't have any peri-wound maceration. Signs and symptoms of infection are gone within 2 weeks, and if we're using it prophylactically, that the wound does not become infected. So that's all in the video. I hope it helped you in your clinical practice, and I will catch you in my next one.